Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Isma from Muhammadiyah Gombong Health Institute. I want to present my research. The title is Revised Trauma Score RTS as a Predictor Mortality Severe Head Injury Patient in the Hospital PKU Muhammadiyah Gombong. Authored by Isma Yuniar, Evi Suarsi, and Endah Setianingsih. The background of the research is road accidents are a very serious problem in Indonesia. In 2014, the police report approximately 28,000 fatality due to accident on the street and roadways of Indonesia. And the fatality rate from traffic accident per 100,000 population was about 12. This is very high compared to neighboring countries like Singapore. In the Singapore, just 4.8. In Australia, 5.2. The phenomena of trauma or injury is a case that often found in the emergency room hospital. Many tools from the polytrauma care exist for better management of this patient, as well as to provide predictive factor of morbidity and mortality in order to generate statistical data for the establishment of preventive measures to trauma. Some of these tools are the trauma score, which are mathematically or statistically valued, quantified by numerical scores, which vary according to the severity of injury resulting from trauma, and help the professional in the care of the injured, especially in the pre-hospital environment and initial treatment in emergency room. There are several trauma scores with different level of complexity for practical implementation. The Revised Trauma Score, or RTS, is widely used by emergency services around the world. It is classified as physiological, since it takes into account parameters of the patient's vital function. This is an improvement of trauma score created in 1981, but without the assessment of capillary refill and respiratory effort, difficult variable to be analyzed in practice. RTS assesses three parameters. The first one is neurological evaluation by the Glasgow Coma Scale, GCS. Number 2 is hemodynamic evaluation by systolic blood pressure, SBP. And the third is respiratory rate, or RR. Depending on each parameter's outcome, there is a corresponding value in the RTS scale able to evaluate the morbidity and mortality of the polytrauma patient, and depending on the severity, indicate the recruitment of more special teams to improve the approach to this type of patient. So, from the study, aim to whether RTS is effective as a predictor of death in severe head injury patient at Muhammadiyah Gombong. So, we hope the research benefit can be used as an additional reference and material for consideration by the hospital using this trauma scoring. The method. This research used a descriptive correlation research type using a retrospective cohort study approach by taking medical record data from 2015 until 2018. In study using all medical record data of severe head injury patients from 2015 until 2018 from January to December. The total was 87. Univariate analysis in the study was severe head injury, such as the characteristic of the respondent: name, gender, age, occupational vital sign regarding the Glasgow Coma Scale, systolic blood pressure, and respiratory rate. And analysis bivariate study was used to determine the effective of RTS on the predictor of death in severe head injury by using the chi-square analysis. The result, the frequency distribution of revised trauma score. The degree of RTS divided to more and severe. In severe, the total is 6 and the mild is 81. And the result of predictor of death in severe head injury patient, life and death, life have the total 40 and death in 47. The bivariate analysis relation between revised trauma and predictor death in severe head injury. The result is p-value more than 0.05, that the hypothesis was rejected. Statistically, the revised trauma score not effective against predictor of death in severe head injury patient. According to the researcher, based on the result of the analysis, the low mortality rate in the first 24 hours was caused by multi-factor that were first found in patient-specific data. In this study, in line with Wahyudianto research, that there was not significant relationship between RTS and mortality in head injury patient in Kediri City. Other analysis, researcher analysis based on the analysis of patient with severe RTS score, but did not die in the first 24 hours because the patient were able to maintain their systolic blood pressure and respiratory rate value even though their GCS score were low. Other factors concerning intervention in meeting physiological needs in emergency, such as pattern of the airway, meeting of oxygenation needs, maintaining cardiovascular condition, and handling less than 6 hours, have been done so that the systemic system and perfusion are still under control. Reflectively, the body will try to meet oxygen needs, maintain perfusion of brain tissue, and prevent hypoxia by increasing the frequency of respiration and maintaining the systolic blood pressure within a normal range. And this research has some limitation. The first one is researcher could not control nursing intervention, could not control medical intervention, investigation, other respondent medical history, only in the secondary data, only use the medical record. So have some limitation. So the conclusion is this study conclude that statistically there was not significant relationship between RTS and the predictor of mortality in severe head injury patient. Okay, it's enough. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.